Okay, guys, now we're going to talk about bipolar disorder. So, bipolar disorder can be very challenging to treat, to interact with, and to love on. And the reason being is because the variations in mood swings. Let me show you what we mean. So this is kind of a brief example of about bipolar disorder. Now, again, there is a lot of different information about bipolar disorder. DSM-5, the Bible of all people, all mental health people. Bipolar disorder can actually be classified as bipolar 1, bipolar 2. But here's the breakdown of it. These patients are going to have these episodes in which they are just woo, swing over here, and then woo, swing down here. And typically it'll all be within the same cyclic kind of a period. So one minute they are on top of the world, they're good for themselves, and the next minute they're not showering, they're not bathing, they're barely getting out of bed every day. Okay. So again, these huge mood swings, the balance gets off, and then these patients can be very challenging to treat and to catch, because when they are manic, they feel really good. When they are depressed, they feel really bad. So when we talk about patients who have bipolar disorder, we talk about that we want to stabilize out their mood. Now, there is some thought process that with our patients who have bipolar disorder, that when they are depressed, do we need to give them a medication to help make them undepressed? The problem is that when you have a depressed patient who's got bipolar disorder and you give them an antidepressant, you're going to throw them into mania, right? So helping the patient to find not the mania, not the depression, but to find the happy medium in between can be a big deal in order to help to make them more successful, to help make them happier. Again, this cognitive therapy that we need to do with these patients in order to help them cope, survive, and work in this in between. Not too high, not too low, just right. So let's take a minute, let's talk about a mood stabilizer. Lithium is probably the most well-known, most well-accepted mood stabilizer out there. It helps to decrease norepinephrine release, so you don't get this, and it helps to increase the happy hormone. So the patient is no longer depressed, they feel happy, and yet they're not having these huge like fight or flight moments all the time. This definitely helps to treat more mania than it does depression though. With the lithium, it can take 5 to 7 days of constant pill administration in order to kind of help get them under control. So sometimes with these patients, they do have to be hospitalized in order to help to treat the mania and to get the lithium time to get into their body to reach its full action potential. This medication does have a very narrow therapeutic range. This medication tends to interfere with the body's ability to look at salt. Lithium is built off of a salt base. And so because of that, sometimes the patient will lose their ability to regulate their salt intake. And so the patient can get pretty hyponatremic because it'll get rid of the salt while keeping the lithium. So very narrow therapeutic index. We have to watch these patients frequently for blood exams. So here's what a patient who has lithium toxicity would look like. Here's kind of the signs and the symptoms as the ranges of their lithium begins to change in their bodies, how they would begin to look. So this is one of those things I probably clip out and put in my mental health section of my Bible of nursing knowledge to keep forever and ever, because you're going to need it. So these patients, again, they're going to pee frequently. You have to ask yourself, can my patient get up and pee? If your patient can't get up and pee, then this is not a good medication match for them, and they may need to do some other things. When I say getting up and pee, I mean like 3 liters a day pee, like they're gonna have to go pee. The medications with the goiter and the hypothyroidism, these might actually go away the longer that they take the medication. However, if the hypothyroidism does become consistent, we may need to give them levothyroxine, because like I said before, and I'll say it again, you cannot be crazy unless you are healthy and crazy. Here's some medications that actually will interact with lithium. So our diuretics like Lasix, hydrochlorothiazide, those sort will actually interact with these medications. NSAIDs will actually increase the renal absorption of lithium, so you'll get lithium toxicity with it. And then anticholinergic drugs increase urinary hesitancy, so now the patient feels like they have to go, but they can't go because they've got this hesitancy thing going on. So watch out for that. If they're on those medications, look at their medication list and ask yourself, what on this medication list is going to act up with lithium? And the answer is everything. So a couple of fast facts about lithium. We definitely need to make sure that this patient has given in for frequent blood draws. I want to make sure that this patient has transportation to get into the clinic to get their blood drawn. If we're going to put them on a medication that has a narrow therapeutic index, we need to know their business. Does your car run? Can you drive? Who's driving? What time are you going to be here? Does the bus come right by here so that you can get off and get your lab work drawn? We have to make sure these patients stay compliant, or else their mania will go back out of control. And I will tell you, these patients can be difficult to work with and for, because they tend to be whoop, 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 whoop. Okay, some of them do really good, but by and large, they're tough to work with. We do have some other mood stabilizers, valproic acid, carbenzapine, and some of even our newer anticonvulsants like lamotrigine. These medications help to stabilize out the mood in addition to preventing seizures. So it's kind of interesting, but we have the medications that control mood and help prevent seizures. So if you have a bipolar seizure patient, you get 2 for 1. Valproic acid is effective against both mania and depression. It tends to be just as effective as lithium, but it doesn't have as narrow of a therapeutic index as lithium. Lithium we have to be super extra cautious with. This one we can be a little bit more lenient with, okay? Again, still has some of the same side effects as lithium, but again, just the higher therapeutic index makes it more favorable over others. Most common side effects is going to be GI. They're going to gain a little weight. Again, with this medication, the other thing is that if they take the valproic acid, also known as Depakote, if we put it in the extended release version, the extended release version has less side effects than just the daily dosing of it. All right, guys, that's all you need to know for bipolar disorder. And we'll catch you later on the next slide.